Have a look at this video and then we will progress with the program.
Andrew, would you introduce yourself, please?
I'm Andrew Comiskey. I'm the founder and director of Desert Stream Ministries, which is an organization that equips the body of Christ to identify and equip lay persons to do pastoral care in the area of sexuality.
I think you knew Dr. Joseph Nicolosi.
Did know Joseph for a long time.
What would you say was his most important contribution in terms of his work?
He provided a clear framework for understanding the gaps in a young boy or girl's development that contributes to the sexualizing of unmet emotional needs later on in life.
What would you say his unique contribution was to the whole field?
I think he brought a piercing clarity to the wound at the core of same-sex attraction, and also a humane and reasonable therapeutic approach for persons who wanted to address that wound therapeutically. So I think it's both the insight and the intervention in terms of reasonable psychotherapy. So he was drawing upon the psychodynamic school of understanding the roots of sexual identity disorders, but he brought such a clear way forward for other therapists to realize I can actually take my training and apply this to effective care for persons with unwanted same-sex attraction seeking help.
And yet there was opposition to his work. Why would you say that was the case?
The opposition came from the very forces that surrounded Joe Nicolosi in Los Angeles in the time that he was being trained there in the late 70s and started his counseling center in 1980. So UCLA, USC, the clinical schools that of any repute in that area were changing the goalposts for psychotherapy in regards to persons with SSA. Joe was in the middle of it, doing good thinking and writing, and also beginning this substantial practice where many therapists were getting trained. And so right up the middle of all of it was this very important stream of life-giving care for persons like myself who were wanting good care in dealing with unwanted same-sex attraction. So he was a well in the desert, if you will, of Southern California in the area of effective, truthful pastoral care and clinical care for persons with SSA.
Give us your reaction when you heard that he'd passed away.
I was devastated because he was so vital. He was a vital 70-year-old. He was a 70-year-old going on 55. And so his exuberance, his joy about continuing to go up the middle of this cultural downdrag in regards to misunderstanding and misinterpreting homosexuality never ceased to enthuse him. He was ever exuberant when it came to making known what the real issues are and the real help that is available for persons with SSA. So to hear that he had passed was unthinkable because he showed absolutely no signs of stopping, and doing it with such a joie de vivre, such an exuberance. So he will be missed. And in that way, he was truly Californian. He did have a kind of pushing the envelope optimism that we can do this. And I think that was unflagging over the course of his entire life.
So what's his enduring legacy, do you think?
I think his enduring legacy is as an insightful, loving, integrated father for healers who want to continue to help individuals overcome unwanted same-sex attraction. I think it's a insightful, heartfelt care of a father to clinicians who otherwise didn't have many mentors to look to.
Andrew Comiskey, thank you for your time.
You're so welcome.
My name's Dermot O'Callaghan. I'm a member of the Science and Research Council of IFTCC. I'm also on the board of Core Issues Trust. Yesterday I bumped into a man called Robert with an American accent, and I didn't put two and two together. I bumped into him again, and then I bumped into him a third time, and it gradually dawned on me, and I asked him, and he said yes, he was. Robert received his master's degree in marriage and family therapy from the University of Southern California. He completed his clinical internship at the Thomas Aquinas Center, where he worked with Dr. Nicolosi, whom we've just seen on the video. He's a staunch supporter of clients' rights, and recently he won an important court case which overturned a law that prohibited him from treating minors who desire sexual or orientation or gender identity change. He's worked in France, Tunisia, Saudi Arabia, and Turkey, and maintains an active interest in multicultural counseling. He's a clinical fellow in the American Association for Marriage and Family Therapy and the Alliance for Therapeutic Choice and Scientific Integrity, and of the Mankind Project. Now, Robert works very closely with David, and it's my privilege now to invite both of them to address us.
Good morning. How's everyone doing? David and I are so happy to be here today. We've recently learned a new therapy called image transformation therapy, and it's very effective in treating all sorts of symptoms and mental disorders. As far as same-sex attraction is concerned, as many of you know, at the basis of same-sex attraction is trauma, and IMTT is absolutely wonderful for the treatment of trauma. Later during this morning, you will have a chance yourselves to experience IMTT for any issues that you may be having. Okay, so without further ado, I'll begin. Image transformation therapy was developed by psychologist Robert Miller during his work with soldiers returning from battle with trauma and PTSD at Camp Pendleton Marine Base in California. Dr. Miller came to realize that it was the pain and terror generated by images stored in the soldiers' memories that kept them prisoner to past events and not the events themselves. So the soldiers would say, Dr. Miller, I remember bombs being dropped in Afghanistan. I remember my buddies getting blown up. I remember seeing the enemy point a gun at me. Okay. Now, these men were in the United States. Their service in Iraq or Afghanistan was over, but they were still traumatized by the events. So Dr. Miller came to realize that it was not the events themselves that produced the symptoms, but the memories. And often the memories that we have are not accurate. We construct memories. So sometimes we construct images that traumatize us. So Dr. Miller began to realize that if we could disassemble or destroy to some effect the memories, we can get rid of the symptoms. Now, you may be asking yourselves, what does this have to do with SSA, same-sex attraction? Well, our clients remember being bullied. They remember their fathers screaming at them. They remember feeling humiliated when they tried to play sports. So we can use IMTT to address all of those issues. He discovered that by eliminating the pain and terror, that's the feeling first, from the body, and then disassembling the memory of the events, we could eliminate the symptoms. Images can be in the forms of memories, thoughts, feelings, or even sounds, right? Some of the veterans from the wars remember hearing grenades blow up. I know a young man who's told me, Robert, I remember physical education class when the instructor would blow the whistle and we all had to play basketball. I remember hearing the dribbling of the basketball and not being able to do it myself. So first we release the pain or terror using a breathing and visualization exercise. It's called the Pain Terror Release Protocol. And number two, then we disassemble the memory using an image deconstruction technique. So here we have the example of bullying. Now I want you to look at the young man who's pinned against the lockers. Imagine the terror he's experiencing when all of these people are against him. Okay? And there we have... what is it, The Scream by Van Gogh, right? Oh, no. Sorry. That's right. Forgive me. The wrong artist. Forgive me. Okay, so we asked the client to give the pain or terror a color. So this is the color red, although it's not very red, is it? Oh, there it is. Okay. Okay, so then we can disassemble the image. Next slide. And then it disappears. And that's the way IMTT works. Okay, IMTT has its origins in the survival model of psychodynamics. Basically, we engage in coping mechanisms to prevent primitive feelings of abandonment and annihilation. For example, shame is a survival mechanism that prevents feelings of abandonment. Okay? Shame prevents feelings of abandonment. We feel bad about the self to remain part of the group. Right? So when we're young and we have problems with our parents, we have two choices. One is to say that the parents are the problem, but if we say that, then we'll feel separate from them. The other alternative is to say we, the children, are the problem. And if we are the problem, then there's hope. And so that's how that works. That's why children actually feel shame. Okay, not eliminating the images can generate a multitude of psychological symptoms besides those associated with PTSD, including anxiety, depression, and addictions. Not eliminating the images allows them to be triggered or activated at any time. This is why in the helping professions, in the mental health professions, we have individuals who will tell us, I have a problem. I have a memory that's come up and triggered me after so many years. It's because it still remains in the psychological system. This means that a person currently without serious symptoms could develop them in the future. Repressed memories do exist. We have found that other psychological interventions are often more time-consuming and less effective over the long term than image transformation therapy. Some psychodynamic interventions, for example, lead clients to dissociate. Okay, we have some interventions, psychodynamic interventions, that ask the client to feel things again, to relive an event. And when you relive an event, you can actually be re-traumatized. That's the bad part of some psychodynamic interventions. And EMDR often involves many eye movement sets to be effective. For those of you who know about EMDR, you have to do these sets, and many times clients get tired of it. I've had clients tell me, Robert, I don't want to do any more sets. Okay? The good thing about image transformation therapy is you usually do it once, twice, sometimes 3 times, and then you're finished. So EMDR processes trauma, but it doesn't rid the entire psychological system of the memories. Likewise, it sometimes superimposes positive feelings over negative ones. We ask clients, what would you like to believe about yourself now? Robert Miller says, don't do that, because if they don't believe, for example, in the case of SSA, if a man doesn't believe he's masculine enough, then he still has a problem. He has a negative belief about himself. Don't superimpose on it. Okay? So it superimposes positive feelings over negative ones, thus leaving the negative feelings intact at some level of consciousness. Image transformation therapy can be used for negative images that result in trauma and positive ones that result in addiction. This is very important. So we have negative events, negative images that traumatize us. But in the case of addictions, for example, pornography, you have a positive experience. This is what makes pornography so addictive, is that the result is positive. Okay? So that's why pornography addiction and other addictions are so hard to treat. But image transformation therapy in the form of the feeling state image protocol, which David is going to talk about later, can be helpful to our clients. All addictions are linked to assured survival feeling states. Now let me explain. Assured survival feelings are very strong feelings that we all seek, often unconsciously, in order to survive. The basic ASFSs are as follows. Okay, the first one is safety. Let me explain these a little bit more. These are feelings we all must have as human beings. If we don't have them, we'll have an addiction. So the first feeling we need is to feel safe. It's a very primitive feeling. I had a client in my practice, and he was engaging in anal sexual relations with other men, often anonymously. And I said, what is it that you get? What do you get when you do this? He said, Robert, I feel safe. I'm with another man, I feel safe. The second is bonding or attachment. And the third is winning. And by winning, we don't necessarily mean winning in a casino. We mean getting rather than not getting. So winning can be finding a mate, finding a spouse. It can mean finding a job, succeeding in life. Winning is always positive. We get something. And the fourth is feeling alive. We must feel alive. If you ask someone who's addicted to cocaine or heroin, what is it that you get? I feel alive. I feel a rush. Okay? ASFs explain why people are tempted to leave one church for another. I've had clients tell me, Robert, I'm changing churches. I'm changing churches. Why are you doing that? Because my pastor is boring. We hear this many times, okay? We know people who do this. We want to feel alive. We want to feel safe. Okay, it also explains why people cheat on spouses, right? The marital life becomes mundane, it becomes boring, so then people cheat. Why we do dishonest things to get our children into prestigious colleges and universities. This is about a scandal in the United States. I don't know if you all heard, but we had many prominent people paying bribes to get their children into some of the best schools because they want their children to win. Often their children did not have the academic abilities. They did not have the capacity to get into Harvard or Yale or Princeton. So then they decided to pay a bribe. IMTT can be used to process negative cognitions that clients bring to session, including I'm stupid, I'm inferior, nobody likes me, etc. First, the therapist releases the pain or terror of the associated memory using the pain terror release protocol, and then deconstructs the images using the image deconstruction protocol. So IMTT generally has two parts. The only time IMTT has one part is if a client comes to session and says, I just have this feeling of worthlessness. Can you help me get rid of it? We will just help them get rid of the feeling. There's usually no memory associated with it. But quite often I will ask a client, do you have any memories of feeling worthless or someone making you feel worthless? In that case, then IMTT has two parts. IMTT can be used to process a myriad of feelings without images that clients bring to session, including feeling anxious, overwhelmed, empty, bored. Okay, those are common complaints of men with SSA. These are called embedded feelings. However, long-term relief may not be maintained if the clients return to environments that generate or have generated these feelings. Well, what do I mean by that? Often in the early life of a man or a young woman who has same-sex attraction, there has not been proper reflection. What do I mean by proper reflection? So if you have, for example, a little boy playing on the floor with his toys, and he says, look, Mommy, look at my truck. Proper reflection would be, you like your truck, don't you? It's a nice truck. Improper reflection or lack of reflection would be, well, that's stupid. Why are you playing with trucks? Okay? Maybe a little boy will tell his father, I want to be a policeman when I grow up. Oh, you want to be a policeman? We need more people who want to be policemen. Okay? Improper reflection would be, well, that's stupid. Why do you want to be a policeman? They get shot. Okay? So what we find is clients who come with symptoms like empty, overwhelmed, bored, often were not reflected properly. As a result, they shut down. As a result, they're unable to get themselves out of that state, that feeling state. So with IMTT, we can help them temporarily, but they must be able to self-activate. They must have the resources within to meet their needs for gratification, healthy gratification. With respect to unwanted SSA, can you think of issues or problems that therapists can address using image transformation therapy? Any suggestions? What you might think? David, do you have any ideas?
Yes. When you're working with an SSA client, what do you think might happen if you work with the trauma of them being bullied? Again, the bullying reference in school. They're shut down, they're shamed, or let's say a parent didn't realize that they were shaming that child in some way, and that shame was a real trauma wound. That would be something that IMTT is tailor-made for, to remove that shame trauma that would have a direct effect on the feelings of their SSA.
All right, and of course we spoke of pornography addiction, feelings of inferiority. They all can be used, IMTT can be used to address those issues. Okay, you will now have the opportunity to experience IMTT involving the release of pain and terror and the deconstruction of the problematic image. Now, Mike, the first part is going to take 15 minutes. Do we have that time, or should we ask for some basic questions first? Of the first part. Is that okay? Okay. So does everyone have this sheet? Okay, so the best way to understand IMTT is to experience it yourself. This exercise is a demonstration of image transformation therapy. This is not psychotherapy, and you are free to participate or not participate in the demonstration at any time. Should you decide to participate and eventually experience overwhelming or distressful feelings, you should stop your participation and seek the help of a mental health professional after the event to process your feelings. So if you just want to sit and watch, you can. If you want to participate, you can do that also. Okay, part one. First, I'd like for you to think of a painful or distressing memory, but don't go too deeply into the feeling. Just be aware of the pain or distress. Okay? I want you to think of an event in your life that distresses you or has distressed you. Now I want you to rate the pain on a scale from 0 to 10, where 0 is no pain or distress at all, and 10 is very intense pain or distress. Okay, this can be something that has happened to you in your life as a child or something recent. Okay. So rate the pain on a scale from 0 to 10. 0 is no pain at all. 10 is very intense pain or distress. You may use 1/2 increments if you wish. If your pain or distress is not at least a 5, the memory and the pain or distress surrounding it may not be intense enough for you to see results. Okay, so I'm going to give you about a minute now to think of an event. Okay, so take a minute. Okay, what we want to do first, to do image transformation therapy, you need to give a color to whatever feeling is associated with the image. So I'd like for you to think of a color, okay? And also to identify where it's located in your body. Now I want you to visualize the pain or distress is composed of tiny, tiny sand-like particles that are the same color as your pain or distress. So we are going to transform the pain, imagine the pain I feel in my chest, to tiny sand-like particles that are the same color as the pain or distress. I want you now to take a slow breath in and visualize breathing air into the particles. So you breathe in and breathe air into the particles and watch them, as you breathe out, watch them leave your body. Then listen to and follow the instructions for the protocol. So I will read to you the protocol. Ladies and gentlemen, for each step, I'd like for you to take 2 to 3 breaths, okay? I want you to breathe into the center of your brain and release the tiny colored particles out the center of your forehead. Breathe in and watch them leave your forehead. Breathe into the center of your brain and release the tiny colored particles out your eyes. Breathe into your chest and release the tiny colored particles down your arms and out the palms of your open hands. I want you to imagine that your spine is composed of guitar strings that go from the bottom of your spine to the top of your head. Breathe into the guitar strings, and as you breathe out, release the tension on the guitar strings, and see the tiny colored particles radiate out in all directions as you first release the tension on the lower guitar strings near your lower back. Now I want you to see the tiny colored particles radiate out in all directions as you release the tension on the middle guitar strings near your middle back. Now I want you to see the tiny colored particles radiate out in all directions as you release the tension on the upper guitar strings near your neck and upper back. I want you to imagine a spot, a place, 30 centimeters beneath your seat in line with your spine. 30 centimeters right beneath your seat in line with your spine. Breathe into that spot and see the tiny colored particles release and flow away from that spot. See the tiny colored particles releasing and flowing away from that spot. Breathe into your abdomen and release the tiny colored particles out your stomach area. Breathe into your abdomen and release the tiny colored particles down your legs and out the bottoms of your feet. I want you to imagine a spot, a place, 15 centimeters below your feet, between your feet. Breathe into that spot and see the tiny colored particles drain down your body, go through the spot, and be absorbed into the earth. See the tiny colored particles drain down your body, go through that spot, and be absorbed into the earth. Now, I would like for you to place your feet flat on the floor. Place your feet flat on the floor. I would like for you to visualize a sphere that is 15 centimeters in diameter, 45 centimeters beneath your feet. Breathe into the sphere. Breathe into the sphere and see the tiny colored particles release from the sphere. See the tiny colored particles releasing from the sphere. Breathe into your diaphragm. Breathe into your diaphragm and release the tiny colored particles out your diaphragm. You're releasing the tiny colored particles out of your diaphragm. Breathe into your heart. Breathe into your heart and release the tiny colored particles out your heart. You're releasing the tiny colored particles out of your heart. Breathe into the depths of your heart. Breathe into the deep, deep depths of your heart and release the tiny colored particles from the deep depths of your heart. You're releasing the tiny colored particles from the deep depths of your heart. Breathe into your throat. Breathe into your throat and release the tiny colored particles out your throat. You're releasing the tiny colored particles out of your throat. Breathe into your voice. Breathe into the depths of your voice and release the tiny colored particles from your voice. You're releasing the tiny colored particles from the deep depths of your voice. Now we're going to go to your brain. Your brain has a right side, a left side, a front, and a back. I would like for you to breathe into your brain, and as you breathe out, release the tiny colored particles out the right side, the left side, the front, and the back. You are simultaneously releasing the tiny colored particles out the right side, the left side, the front, and the back. Breathe into the center of your brain. Breathe into the center of your brain and see the tiny, tiny colored particles releasing and radiating out in all directions from the center of your brain. See the tiny colored particles releasing and radiating out in all directions from the center of your brain. Breathe into your mind. Breathe into the deep depths of your mind and release the tiny colored particles from your mind. You're releasing the tiny colored particles from the deep depths of your mind. Breathe into the core of yourself, which is your soul. Breathe into what you think of as the core of yourself, your soul, and release the tiny colored particles from the core of yourself. You're releasing the tiny colored particles from the deep core of yourself. I want you to imagine that you're about to yawn. Imagine that you're yawning a deep, wide yawn. As you yawn, see the tiny colored particles release from the core of yourself. As you feel the yawn throughout your whole body, see the tiny colored particles releasing from the core of yourself. Now, ladies and gentlemen, I'd like for you to scan your body to see if there's any more colored particles remaining. If there are, breathe into that part of your body and then breathe the tiny colored particles out the pores of your skin in that area. So if you find any more of those colored pain or distress particles, I'd like for you to breathe them out the pores of your skin wherever you find them. Okay, now I'd like for you to open your eyes, and I'd like for you to rate the intensity of the pain or distress again. Without looking at the number you put at the beginning of the exercise, go ahead and put a number now that corresponds to the level of pain or distress of the memory, and then let me know, did it decrease for you? Did the number decrease? So this is what most of our clients tell us. Okay, so we have to stop now, and then after the break, we're going to finish the exercise. Okay?
So you've just seen one half of the trauma process, the PTRP. You're not done yet. So come back after the coffee break, because we're going to Robert is going to help you deconstruct the image and hopefully get rid of that trauma or distress that you are working on today. Just a bridge question to more of my main part after the coffee break, which will be the bulk of the lecture next. If there are any volunteers, I'm not forcing you at all, but if there's any volunteers with, let's say, an addiction to pornography or SSA of any kind, and if you would like to be brave and be my guinea pig up here to see me demonstrate the next process after Robert is done, come see me right after we end this talk. Just come up to the front immediately and see me if you'd like to volunteer. Or if you're a therapist that wants to just participate and learn more about the process, up front here with me that will demonstrate into a mock session. Either way, just come see me at the end, well, right now.
Okay, So as I was saying, IMTT relies a lot on color. So I have a joke for you about color. And I wasn't going to tell the joke because David Pickup told me, Robert, jokes don't always translate well into other languages. But I said, nah, this one I think will work. So there was a little girl with her mother at a wedding. And she turned to her mother and said, Mama, why does the bride wear white? Why does she wear white? And the mother said, honey, white is the color of purity. It's the color of hope, the color of light, hope for the future couple. And she turned to her mother and said, why does the man wear black? And the mother said, black? I don't know. You see, I thought you'd like that. Okay, so in the first part of our presentation, we had you get rid of the feeling associated with the image. Now we are going to do the second part. We're going to destroy the image. What I'd like for you all to do is I want you to go back to the disturbing image that you came up with during the first part of our presentation. And I want you to put the image on a computer screen. Now, as you know, anytime you have something on a screen, the image is composed of tiny, tiny little pixel particles. So I want you to imagine that the image is on a screen and is composed of pixel particles. Now, I'm going to give you a mallet, a hammer. And what I want you to do is I want you to destroy the image and allow the pixel particles to fall into a box under the computer screen. Okay? So all of you right now, take your hammers and destroy that disturbing image and let the pixel particles fall into a box under the computer screen. Okay? Take about 15 seconds, and then I'll give you the next instruction. Okay, now I'm going to give you a glue. And I want you to take the particles and with the glue, as best as you can, put the image back and see how it looks. Of course, it will probably look fragmented, right? And what I want you to do is I want you to continue the process. I want you to take the mallet, the hammer, and destroy that image and let the pixel particles fall into the box. And when you've done that, put them back on the screen and take a look. And I want you to do that until the image is scrambled. We don't want you to see any defining characteristics of the original image. So I'm going to give you about a minute to do that process. Keep putting the pixel particles on the screen, destroy the image, let it go into the box, and do the process again and again until you cannot make sense, till you cannot see a clear image. Keep destroying the image. Our hope is to get you to a place where you cannot see anything. But if you see an image and it's completely fragmented and you cannot make out any characteristics, you're in a good place. Okay, all images or parts of images are in the psychological system. So what we're going to do now is we're going to breathe them out of the psychological system. Just like before, I'd like for you to take 2 to 3 breaths for each part, Okay? So these pixel particles, these images are in your system. What I'd like for you to do now is to breathe into the center of your brain and release the tiny pixel particles out the center of your forehead. Release the tiny pixel particles out the center of your forehead. Breathe into the center of your brain and release the tiny pixel particles out your eyes. Breathe into your chest and release the tiny pixel particles down your arms and out the palms of your open hands. I want you to imagine that your spine is composed of guitar strings that go from the bottom of your spine to the top of your head. Breathe into the guitar strings, and as you breathe out, release the tension on the guitar strings and see the tiny pixel particles radiate out in all directions. As you first release the tension on the lower guitar strings near your lower back. Now see the tiny pixel particles radiate out in all directions as you release the tension on the middle guitar strings near your middle back. See the tiny pixel particles radiate out in all directions as you release the tension on the upper guitar strings near your neck and upper back. I want you to imagine a spot 30 centimeters beneath your seat in line with your spine. 30 centimeters beneath your seat in line with your spine. Breathe into that spot and see the tiny pixel particles release and flow away from that spot. See the tiny pixel particles releasing and flowing away from that spot. Breathe into your abdomen and release the tiny pixel particles out your navel area. Breathe into your abdomen and release the tiny pixel particles down your legs and out the bottoms of your feet. I want you to imagine a spot, a place, 15 centimeters below your feet, between your feet. Breathe into that spot and see the tiny pixel particles drain down your body, go through the spot, and be absorbed into the earth. See the tiny pixel particles drain down your body, go through that spot, and be absorbed into the earth. Go ahead and place your feet flat against the floor. Okay? Put your feet flat against the floor, please. And I'd like for you to imagine a sphere, a globe, 15 centimeters in diameter, 45 centimeters beneath your feet. Breathe into the sphere. Breathe into the sphere and see the tiny pixel particles release from the sphere. See the tiny, tiny pixel particles releasing from the sphere. Breathe into your diaphragm. Breathe into your diaphragm and release the tiny, tiny pixel particles out your diaphragm. You're releasing the tiny pixel particles out of your diaphragm. Breathe into your heart. Breathe into your heart and release the tiny pixel particles out your heart. You're releasing the tiny pixel particles out of your heart. Breathe into the depths of your heart. Breathe into the deep, deep depths of your heart and release the tiny, tiny pixel particles from the deep depths of your heart. You're releasing the tiny pixel particles from the deep depths of your heart. Breathe into your throat. Breathe into your throat and release the tiny pixel particles out your throat. You're releasing the tiny pixel particles out of your throat. Breathe into your voice. Breathe into the depths of your voice and release the tiny pixel particles from your voice. You're releasing the tiny pixel particles from the deep depths of your voice. Now we're going to your brain. Your brain has a right side, a left side, a front, and a back. I'd like for you to breathe into your brain, and as you breathe out, release the tiny pixel particles out the right side, the left side, the front, and the back. You are simultaneously releasing the tiny pixel particles out the right side, the left side, the front, and the back. Breathe into the center of your brain. Breathe into the center of your brain and see the tiny, tiny pixel particles releasing and radiating out in all directions from the center of your brain. See the tiny pixel particles releasing and radiating out in all directions from the center of your brain. Breathe into your mind. Breathe into the deep depths of your mind and release the tiny pixel particles from your mind. You're releasing the tiny pixel particles from the deep depths of your mind. Breathe into the core of yourself, which is your soul. Breathe into what you think of as the core of yourself, your soul, and release the tiny pixel particles from the core of yourself. You're releasing the tiny pixel particles from the deep core of yourself. Imagine that you're about to yawn. Imagine that you're yawning a deep, wide yawn. As you yawn, see the tiny pixel particles release from the core of yourself. As you feel that yawn throughout your whole body, as you feel the yawn throughout your whole body, see the tiny pixel particles releasing from the core of yourself. Now I'd like for you to scan your body to see if there's any more pixel particles remaining. If there are, breathe into that part of your body and then breathe the tiny pixel particles out the pores of your skin in that area. So if there are any more of those pixel particles remaining in your psychological system, in your body, I'd like for you to breathe them out the pores of your skin wherever you find them. Okay, you can open your eyes, And now what I'd like for you to do is once again reevaluate the disturbing image. Has the disturbance lessened? Can you give it a number? Is the number less than what you began with? Maybe 0. Many of my clients report 0 disturbance, 0.5, maybe 1 after doing IMTT. Okay, so now I'm going to transfer over here to David, who's going to do the second part, which is FSIP, which is Feeling State Image Protocol, which will help you understand how we use IMTT for addictions.